Hi, this is still Arushi, and in this section of Unit 1, we'll go over terminology. This is a little off topic from the rest of the unit, but an extremely important topic that anyone who wishes to go into medicine needs to know. We learn terminology because it eliminates any ambiguity in medical practices. Say you're getting checked by multiple doctors because you have a lump in your stomach and you want several references. One doctor says it's on your stomach, but where? Like, what do they mean? The side, the bottom, the top, middle, like where on your stomach? These terms help clear that so that both you and the doctor know exactly what part and location of the body you're talking about, because you need that kind of clarity in medicine. So first we'll go over anatomical position, which is referenced in every term. For example, the anterior hand will be your palm in anatomical position, and an anterior palm when your hand is face down on a table will still be your palm, because anterior is always referred to in anatomical position. So anatomical position is when a person is standing up, looking forward, hands are at your side with your palms facing out, and your feet are pointed forward. This is anatomical position with many labels of regional areas in the body. I won't go over them, but you can pause and skim over it. The most clarifying terms you'll ever hear are these directional terms. I'm just going to go down the list and give an example for each. Prone is lying face up on your back. Supine is lying face down on your belly. Anterior, also known as ventral, is the forward position of your body. For example, your toes are anterior to your foot. Posterior or dorsal is the opposite, meaning the back of the body. An example would be the heel is posterior to the toes. Superior refers to the higher levels of the body. You can say your head is superior to your foot. Inferior is the opposite, it's lower in relation to, and you can say that the foot is inferior to the head. Medial is referring to the part that's closer to the midline, which is an imaginary line running down the middle of your body. An example would be saying that the thumb is medial to the digits. Lateral is referring to a part further from your midline, and that can say the digits are lateral to the thumb. Proximal refers to the end of a limb that's closer to the place where it attaches to the rest of the body. You can say your upper arm is proximal to the lower arm because your shoulder is where it joins. Distal is the end of the limb that's further from the rest of your body. An example would be saying that the lower arm is distal to the upper arm. Superficial refers to something closer to the surface of the skin. For example, the skull is superficial to the brain. Deep refers to something further from the surface of the brain. For example, the brain is deep to the skull. Here's a diagram that helps visualize all of the directional terms, and you should really pause here because descriptions are not enough when you're trying to visualize things. Body planes are how you cut the body, essentially. The sagittal plane divides into the left and right sides. The frontal or coronal divides into the front and back half, and the transverse just separates your upper and lower body. On this slide, you can see the planes more clearly, and definitely pause. The body also has body cavities, which are just sections of the body that contain organs. The anterior cavity is huge, so it gets subdivided into the thoracic and abdominopelvic cavities. The posterior cavity gets subdivided into the cranial and spinal cavities. Here you can see the cavities better, and they even go more into depth. That's all for this unit, and I hope you enjoyed learning the basics of the structure of the body and some terminology. I guess you move on to Unit 1 now. Have fun. Thank you. Bye.